Well, Breast Cancer Awareness Month may be over, but it's always important for us to nurture our health and wellness. So today we have an important reminder for women with implants to never skip those mammograms. Take a look at this recent conversation that Kid had with his good friend, Dr. Troy Pittman from Pittman, MD.
Transformation Tuesday on Good Morning Washington is sponsored by Pittman, MD. We are back with Dr. Troy Pittman and an important spotlight on breast cancer awareness during Breast Cancer Awareness Month. Always great to see you, and we're going to learn a lot of things here today. Important information for men to know and women to know. But let's start with some true or falses here. I've heard that women who have implants have to have them replaced every 10 years. Is that true?
So the answer is really it depends. Women who have breast implants, who got them put in 10 years ago, those implants had about a 25% rupture rate at 10 years. So if 1 in 4 women were going to have a rupture, we would tell them, you're probably going to need to have these replaced in 10 years. We have newer implants now, and those implants have only about an 8% rupture rate. And so the answer to the question is really it depends.
So what are some of the reasons that women would need to have their implants replaced?
So I think probably the most common reason is something called capsular contracture. That's where the implant gets hard. It feels hard. It can be uncomfortable for the patients. That can either be a result of just timing, or it can be a result of a rupture. And so the most important thing is that women are following up with a board-certified plastic surgeon, that they're getting their normal mammograms, that they're doing their breast self-exams, and if they have a problem, they see a specialist.
Wonderful. Do you mind taking some viewer questions that we have here?
Absolutely.
All right, Lisa from Fairfax writes in, and she says she just finished breastfeeding and has noticed some changes in her implants. What are her options now?
So with pregnancy, the breast is going to enlarge. And with breastfeeding, the breast deflates. And so a lot of women find that their breasts are saggy and deflated. And so we can do a breast lift. If they want a little bit more volume or they don't have enough breast tissue, we can do a breast lift with an implant.
Let's talk about breast goals, because I've learned, and this was happening over happy hour the other night, one of my friends was talking, your breast goals change as you change with age as well. What you wanted in your 20s and 30s is different what you wanted in your 40s and 50s. What are options for people like that?
Yeah, absolutely. I think women who come in their 20s who look for a primary breast augmentation, that's implants that are going to give them a lifted, rounded look. As women transition into their 30s and 40s, they become moms. They may want something a little bit more understated. And then women later in life, in their 60s and 70s, may want to have their implants taken out altogether.
And there are options for women that want to have their breast implants taken out.
Absolutely. So women who want to have their implants taken out, they come in, we remove them. If they are concerned about the aesthetic of the breast, we can then perform a breast lift. Or we can do what's called a fat transfer, where we do liposuction of one area and then put the fat that we take out, we purify that fat and put it in the breast to volumize it.
A great question here from Karen in Potomac says, are breast implants safe?
So the answer is yes, breast implants are safe. They've been the most studied medical device in the history of the FDA. And breast implant technology has really improved over the last 50 years. And so our new 5th generation implants have lower rupture rates, lower rates of capsular contracture, and really patients with implants just need to be aware. They need to know their body. They need to be following up with a board-certified plastic surgeon. They need to be having their mammograms, doing their monthly self-exams. And but yes, they are safe.
Okay, and let's talk a little bit more about what you have here to show us a little bit about the safety that we were talking about. If a breast implant ruptures, I was asking, is that dangerous? And it's not.
That's right. So these are all 5th generation. We call them gummy bear implants. And so this is one that I've ruptured myself. So if you rupture this implant and you look at it, it's like a gummy bear. So you turn it upside down, it's like you bit a gummy bear and you turned it on its side. So when this implant ruptures, the silicone doesn't run out like it did with the older implants.
What's your advice for women that are getting mammograms who have breast implants?
So just let the mammography center know that you have implants, and they do a specific type of mammogram. Traditionally, with mammograms, we do an up and down view, a side to side view. but there are 2 extra views they do for women with implants to really push the breast away from the implant. The mammogram will not rupture the implants. These new implants you could run over with a car, and they will not rupture. So that's another big concern with patients.
You know, if you follow Dr. Pittman on Instagram, you recently posted about one of your patients that was celebrating their anniversary of their implants and how it changed their life. You work with patients every single day. What's it like for you when you see people's lives transformed?
Well, I mean, that's why we do what we do, right? Is to give patients a renewed sense of self, increased self-esteem, make them feel better, make them feel less insecure about things that bother them.
Dr. Pittman, thank you so much for being here today. Important information for men and women to know about. We really appreciate your time.
Thank you.
Yeah, so good. And such important information, you know, for all women. Get your mammograms. But I love how Dr. Pittman is just so approachable, because there's so many questions that I'm sure you have when going through the process, and maybe you feel like a little uncomfortable, but they just seem to make, and I love that demonstration. Like, it totally makes sense. And I'm just amazed at the advancements. And also, by the way, their spa, it's like top of the line. It is so gorgeous.
Top notch. And we are so excited to announce that we are launching Transformation Tuesday with our partners, Somnick and Pittman MD. Dr. Michael Somnick is a board-certified facial plastic surgeon, and Dr. Troy Pittman is a board-certified plastic surgeon. We are thrilled to be partnering with them and their award-winning plastic surgery practice to answer all of your top questions during Transformation Tuesday right here on Good Morning Washington. So make sure you get us those questions, and we'll see you back here next Tuesday for another Transformation Tuesday.
Exactly. All just trying to be better versions of ourselves.
And I love visiting their office because you walk in and it's just, they're warm, welcoming, and it's just a nice place to go.